Hello students, today we will discuss about the functional areas of parietal lobe. Now when you will see the outer surface of the cerebrum, you will see that this cerebrum is having the central sulcus. Now this area in front is known as frontal lobe, and if you will have the imaginary line which is passing from the pre-occipital notch, which is here, to the parieto-occipital sulcus, and if you will draw a horizontal line from the lateral sulcus, this area is known as parietal lobe. Now in this parietal lobe you have the intraparietal sulcus. There is a sulcus is known as intraparietal sulcus, and this intraparietal sulcus is dividing this whole parietal lobe into the two parts, this upper part and the lower part. The upper part is known as superior parietal lobule. It is known as superior parietal lobule, and this lower one is known as inferior parietal lobule. So we'll see that this parietal lobe is in the posterior part is having the superior parietal and inferior parietal lobule, plus when you will see the area adjacent to the central sulcus. Now this area adjacent to the central sulcus is known as post-central gyrus. It is known as post-central gyrus. So when you will see the brain in the parietal lobe that is behind this central sulcus, this area is having first post-central gyrus, superior parietal lobule and inferior parietal lobule. Now apart from that, there are two more important gyrus. One is known as supramarginal gyrus. Now this is the lateral sulcus, and this lateral sulcus projects into the inferior parietal lobule, and the area around this posterior part of the lateral sulcus, this area is known as supramarginal gyrus. Supramarginal gyrus. In the same way, you have here the superior temporal sulcus that will also go and project into the parietal lobe, and this area around the superior parietal sulcus, this area around the superior parietal sulcus is known as angular gyrus. It is known as angular gyrus. So if you will see the named areas, named sulci and gyri into this parietal lobe, we will discuss first about the areas which are present into the central sulcus, that means here, that is the first. Then we will discuss the area present into the superior parietal lobule, then into the inferior parietal lobule, and we will discuss about these two areas. One is known as supramarginal gyrus and this is angular gyrus. So what is supramarginal gyrus? The part which is overlapping the posterior end of the posterior part of the lateral sulcus, and the angular gyrus means the area which is present along the posterior part of this superior temporal gyrus sulcus. Clear? So this is the superior temporal sulcus, and the area which is occupying this posterior part is known as angular gyrus. So these are the structures which you will see into the parietal lobe. Now what are the functional areas we are going to see here? The first and most important functional area is known as primary sensory cortex. Primary sensory cortex, or it is also known as area S1, or it is also known as primary somatostatic area. Second is, we will see the secondary sensory cortex. Second, we will see the secondary sensory cortex. And third is known as somesthetic association area. Somesthetic association area. Now, some books also include the sensory speech area. Some books also include the sensory speech area in the list of the functional areas of parietal lobe. So in the functional areas of parietal lobe, you have the most constant three areas: primary sensory, secondary sensory cortex, and somesthetic association area. And some will have the sensory speech area, which is also known as Wernicke's area. It is also known as Wernicke's sensory speech area. Now, first we will see the primary sensory cortex. Now, when you will see the primary sensory cortex, the first question is that what is the meaning of primary and what is the meaning of secondary cortex. Now, when you will see the sensory areas, in that we are using the word primary and secondary. Now, the primary cortex, the primary sensory cortex means the area which is receiving the chief or the main input which are coming from the thalamus. As we know that the thalamus is projecting to the cerebral cortex, which are known as thalamocortical fibers, and the area of brain which is receiving the chief or the main input. Plus, this area is responsible for the determine or for the integration of those inputs which are sensory in nature. So, what is the meaning of primary? The primary area is the area which is basically receiving all the chief input or the principal input or the main input which are coming from the thalamus, and in that area we have the determination and integration of those chief sensations. Now, what is the secondary area then? The secondary areas are the areas which lies outside the primary area. These lies outside the primary area, and the secondary area receives input from the primary as well as from the thalamus. They may receive the fibers from the primary or from the thalamus or from the both. And these regions are smaller and the primary areas are bigger. Primary areas are bigger in size while the secondary areas are smaller in size. So that is what is the basic difference. And the second basic difference is that when you will have the lesion in the primary areas, the affection, that means the sensory loss, is very much high. But if there is a lesion in the secondary areas, the affection may be there, or if the impact is very less. So the secondary areas are receiving the fibers from the primary or from the thalamus, and the primary areas which are the chief relay station for the principal fibers or the main input fibers to the sensory cortex. Now when you will see the primary sensory cortex, now this primary sensory cortex is also known as granular cortex. It is known as granular cortex. As we have seen that the premotor cortex, pre-central gyrus, that is the primary motor area, is known as agranular cortex. This is known as granular cortex. Now why this is granular cortex? Because it is having the large amount of stellate cells. Because it is having the large amount of stellate cells and very less number of pyramidal cells. The pyramidal cells are very less in number, while the stellate cells are most important cells which are seen into the primary sensory cortex. Second thing is that where you will find this primary sensory cortex. So the primary sensory cortex occupy the gyrus just behind the central sulcus. So this gyrus is known as post central gyrus. This is known as post central gyrus, and this is your central sulcus. So this post central gyrus is occupying the primary sensory cortex, and the Brodmann's area number 3, 1 and 2. The area number 3, 1, 2. Now this 3 is divided into the 3A and 3B. It is divided into the 3A and 3B. What is the meaning of this 3A, 3B? That if you will take the section, transverse section of the sulci gyri, now this is your central sulcus, this is your pre-central gyrus, this is your post-central gyrus. Now when you will see the area, now this is the floor. Now this is the floor. Now this floor is occupied by the primary sensory cortex, area number 3A. 3A. While the posterior wall of the central sulcus and some part of the gyrus is occupied by the area 3B. While the anterior wall of your central sulcus is occupied by the area, Brodmann's area number 4, that is your motor cortex. So when you will see the central sulcus, the floor is occupied by the area 3A, and the anterior wall is occupied by the Brodmann area 4, which is motor cortex, and the posterior wall is occupied by the sensory cortex, area 3B. So what is the 3A? It is deeply buried into the floor. This is the question: which area buried in the floor of central sulcus? The answer is 3A. That is the sensory cortex. And what area present in the posterior wall of the central sulcus? 3B. And which area present in the anterior wall of central sulcus? Motor cortex, area number 4. So that is what is about this 3A, 3B. Here the center part is occupied by the area, Brodmann area number 1, and this posterior most is the 2. So when you will see here in the book or wherever you will have the sequence, you will have the 3, 1, 2 Brodmann's area. When we will see into this post central gyrus, how we will label 3, 1 and 2. So that is what is about the position of the primary sensory cortex. Now what are the fibers and what are the functions of this area? So the first and important thing is that this area receives the main input from the thalamus, that is the thalamocortical fibers, and these thalamocortical fibers are coming from the ventroposterolateral and ventroposteromedial nuclei of thalamus, which are known as thalamocortical fibers. Now when the fibers will enter into this primary sensory cortex, they will stimulate the neurons, particularly the neurons which are present into the layer 4, and when you will have, as you know that what is this layer 4? There are 6 layers. There are 6 layers into the neocortex histologically. So I am talking about that 4th layer in the histology. And these neurons of the layer 4 will stimulate the whole neocortex, and your output will come out mainly from the layer 6. And these fibers then will go into the primary motor cortex. These fibers will go into the primary motor cortex, where they influence the motor output. That means here you will have the pre-motor cortex, and this is your primary motor cortex, so primary sensory cortex. So the sensory cortex and the motor cortex are connected by these type of association fibers. So the sensory cortex influence the primary motor cortex, and that is what is about the influence of the sensation on the motor output. Apart from that, what will happen, that some of the fibers of corticospinal and corticonuclear fibers also take origin from this primary sensory cortex. So primary sensory cortex will also give some of your corticospinal and corticonuclear fibers. Now these corticonuclear and corticospinal fibers will go and influence your posterior column neurons of spinal cord. Posterior column neurons of spinal cord. Why? Because this posterior column is actually having the sensory neurons. Those will give rise to the sensory input to the brain. So these fibers will go and influence these neurons, and they will modulate the intensity of sensory input. What they will do? They modulate sensory input intensity. So they will modulate the intensity of sensations in this posterior column of spinal cord. So what are the important functions of the primary sensory cortex? So the primary sensory cortex is a chief area where you will have the interpretation of your exteroceptive and proprioceptions. So exteroceptives like pain, touch, temperature, pressure, and exteroception like the position of your joint and your which comes from the muscle spindle. Now if you will see the area number 3A and 3B, this 3A is mainly concerned with the joint position and 3B is concerned with the exteroceptive fibers like pain, touch and temperature. Now the fibers, those are coming from the muscle spindles, they mainly relay into this area 3A, and the output will go to this from here to the primary motor cortex into the precentral gyrus, and that will influence the motor output. So what is the role of this 3A, 3B? That they are also giving the projection to the motor cortex. So that is what is about the primary sensory cortex. Okay? So whenever you will have the primary sensory cortex, you have to know about the area number, that is 312, what is 3A, what is 3B. Then you should know about the role of the primary sensory cortex, that it is the chief site where you will have the interpretation and determination of the chief sensations which are coming from the thalamus. So whenever there is a lesion, now when you will see this primary sensory cortex, in this sensory cortex we also have the representation of the body, and that representation is just like the motor cortex, which is upside down, and it is also known as sensory homunculus. It is known as sensory homunculus, and in this sensory homunculus we are having the sensations of the upper part of the body in the lower area and the lower part of the body into the upper area, and that will go into the posterior part of the paracentral lobule on the medial surface also. So that is also having the sensations of defecation and micturition in the paracentral lobule posterior part in the medial surface. So you will find that the representation of the body areas are here, and that representation is depend upon the number of sensory receptors present in the body part. So if you have more number of the sensory receptors, the area occupying in the sensory cortex is also large. If you have the less number of the sensory receptors, the area representing into the sensory cortex is small. So again you will have the homunculus where you will have the disproportionate size of the body parts, and that is actually determined by the number of sensory receptors, not by the size of the organ or the body part. So this is what is about the homunculus, sensory homunculus. And if you will have the lesion in this area, if you will have the lesion in the primary sensory cortex, we have the loss of sensation in the contralateral side of the body. We have the loss of the sensation in the contralateral, except some crude touch and crude pain, because the thalamus is also have the capacity to judge or to sense the crude touch and crude pain. But their point-to-point identification or their two-point discrimination is the function of primary sensory cortex. So patient lost that fine touch, but the crude touch he may able to judge because of the presence of thalamus, because of the thalamus. So whenever you have the lesion into the primary sensory cortex, it is always associated with the loss of sensation in opposite half of the body because of the crossing of the fibers. So this is what is about the primary sensory cortex. Now we will discuss about the somesthetic association area. So when you will see the somesthetic association area, this somesthetic association area present into the superior parietal lobule. So if you will see this part of the parietal lobe, as I told you, this is the central sulcus. Here you will have the superior parietal lobule, this is the intraparietal sulcus. So this superior parietal lobule on the lateral surface, plus if you will go on the medial side, on the medial surface we have area is known as precuneus. Precuneus. Now that precuneus plus the superior parietal lobule both are having the somesthetic association area. As per the Brodmann's classification, they are labeled as a Brodmann area number 5 and 7. They are giving the Brodmann's classification number area 5 and 7. So somesthetic association area location, what is that? Superior parietal lobule and precuneus. Now where you will find the precuneus? On the medial surface. Now what is the function of the somesthetic association area? Now this somesthetic association area is known as site for the sensory memory. Site for the sensory memory. Now what is the meaning? That this area actually store your past sensory experience. It store the past sensory experiences. So because of these past sensory experiences which are stored into this somesthetic association area, we are able to do the previous learned movements. So it is helpful to initiate the previously learned movements, plus because of the past sensory memory we are able to identify the objects, because this area is store site for the texture, for the shape, size. You can judge the weight of an object. So all these things are possible to identify because if you had these things in past in your hand. What does it mean? That if I will ask you to close the eye and I will give a coin, you are able to say, sir, this is the coin. If I will give the pen in your hand, you can identify the pen, you can go on the tip and you will realize this is the tip, so it is a pen. Or if you will have the mobile in your hand. So why we are able to identify? Just by the sensation by the feeling, because this superior parietal lobule and precuneus stores the texture, shape, size and weight with the past experiences, and this is known as stereognosis. This is known as stereognosis. So what is stereognosis? Stereognosis means identification. The person is able to identify the object with because of the past sensory experiences. But if there is a lesion, in this superior parietal lobule, that is Brodmann's area number 5 and 7, then this term is known as astereognosis. That means person will have agnosia. Agnosia means that now he is not able to identify. So when you will give the coin again to that person and ask them what is this, at that time, because of the injury into the superior parietal lobule, he is not able to reply because injury is there, so the past sensory information is not there, and because this reason the person is not able to reply, and that is known as astereognosis. Now this is the important thing which you have to realize, that the primary sensory cortex of that person is normal. So the person will able to feel the coin. Person is able to feel the thickness of that coin. But now it is considered as a new input. Now that is considered as a new input, new sensory input. So because the primary area is normal, the person is able to feel, but he is not able to recognize because his past experience memory is lost. So that is the difference, that the fellow is able to feel or not. Yes, he is able to feel, but he is not able to reply because of the loss of his sensory memory. Now the second thing is that if there is a severe form of the lesion, if there is a extensive lesion will occur, then person is not able to identify half of his body. Now this is basically the function of right lobe of parietal area, right parietal lobe. You know that we have the right and left cerebral hemisphere. So this stereognosis is basically the function of the left cerebral hemisphere. In the right cerebral hemisphere, the superior parietal lobule is basically concerned with the awareness of individual's own body. Awareness for individual's own body. Now, when you will have the lesion into the right side of the superior parietal lobule, person is not able to take care of his own left side. That is known as cortical negligence. Now what is the meaning of this cortical negligence? That means when a person is doing the shaving, because there is a lesion into the right side, he will not shave off his left of the face. In the same way, when a female is doing the comb, now she will not comb the left side of hairs. So the awareness for the opposite half will lost, and it will seen when there is a extensive lesion into the right parietal lobe. So that is the important function of the right lobe, that it is responsible for the awareness of an individual for his own body. And when there is a lesion into the right superior parietal lobule, the problem comes is that is a severe kind of agnosia, and this is known as cortical negligence, where the individual not take care of the half of her or his body. So that is what is about the association area. Now we'll discuss about the secondary sensory area. Now the secondary sensory area is present into the lowermost part of the posterior parietal lobe. Lowermost part of the posterior parietal lobe, where you will have the lateral sulcus, where you will have the entry of lateral sulcus. Now this is the lateral sulcus. Now this, in this posterior part of the parietal lobe, this is the parietal lobe. Now this is the posterior part of the parietal lobe and this is the lateral sulcus. Now where you will find this secondary sensory area. Now this secondary sensory area is seen into this lip of lateral sulcus, where you will find into the lip of lateral sulcus. It is buried into this area. Now if you will see that, suppose this is the lateral sulcus. Now this lateral sulcus is a fissure. It is a fissure. So below that you will have the temporal lobe and above that you will have the parietal lobe. Now into this fissure, which is known as lateral sulcus, along this upper lip of the lateral sulcus, you have the area is known as secondary sensory area. Now this secondary sensory area is mainly, experimentally it is seen that it is mainly concerned with the pain sensations. It is mainly concerned with the pain sensations, and if there is a lesion into these areas, they are not going to affect much, or their effects are almost negligible. So when you will see the secondary sensory area, where you will find the secondary sensory area, answer is along the upper lip of the lateral sulcus, and it present in the posterior part of the parietal lobe, and their function is not much elaborated, not much known, and it is said that they are concerned with the pain. So if the person is having very severe intractable pain, sometimes if will damage this area, then it may relieve the pain. Otherwise the injury of this area does not affect much. Now you will have the fourth functional area of the parietal lobe, which is known as sensory speech area. That is known as sensory speech area or Wernicke's area. As I already told you that in this part we have the two more gyrus. One is known as supramarginal gyrus. So this is the lateral sulcus, and along the lateral sulcus this area is the supramarginal gyrus, and the another area which is along the superior temporal sulcus. Now this is known as angular gyrus. It is known as angular gyrus. Now these areas are having the sensory speech area or Wernicke's area. Now this area labeled as a area Brodmann's classification number 40, and this is area number 39. It is area number 40 and this is 39. But when you will see the Wernicke's area, it also occupying the area number 22, which is the part of superior temporal gyrus. Okay? So whenever you are reading the sensory speech area, it is not only the 39 and 40, but it also includes the area number 44. Now this area is for the comprehension. This area is for comprehension of your language. Now Wernicke's area receives input from the two areas, from the visual input and from the ear, that is auditory input, and then the comprehension will take place here. Then the fibers will go to the Broca's area, and here in the Broca's area what will happen? The command will initiate, and those command will go to the motor cortex, and we are able to reply or write. But the important thing is, because this area is related to the comprehension, so if there is a damage into this Wernicke's area, person is not able to comprehend. The fluency will maintain, but the comprehension will lost. So will he or she will reply some non-existent word, and these are the hypothetical words. These are the hypothetical words. The person will have the aphasia. We'll see in detail about the connections and how this pathway will work when we will have the video on the language areas of the brain and how the word formation will occur. So we'll have the separate video on that. But to just complete the list here about the functional areas of the parietal lobe, again I will tell you there are 4 areas. One is known as primary or the chief sensory cortex, then you will have the association area, then you will have the secondary sensory cortex, and the fourth is this sensory speech area or Wernicke's area. So that is what is about the parietal lobe functional areas of brain. Thank you for watching this video.